welcome to This is Public Health. I'm Pamela Kirkland with the West Central Health District here in Columbus. And today we're going to be talking about the COVID-19 vaccine. We have literally been getting hundreds of calls every day at our call center in Columbus asking us questions about the vaccine, and so today we're going to give you some of those answers. Joining us today is the West Central Health District Program Manager, Dr. Sante Hiltz. Good to see you.
Good morning.
How are you?
Doing great.
Good. Are you ready?
Yes.
Okay, let's get started. One of the first questions that we've heard is the vaccine safe and can it give me COVID-19?
And that's a question that we're getting a lot in our call center as well. And the vaccine is safe and it cannot give a person COVID because it is not a live virus. That's the vaccine that we're using here in the United States. Mm-hmm. It is not a live vaccine. It's not a live virus.
So there's no way that it can give it to you?
No.
Okay, good. All right. Another question that people have, and I'm sure you've heard them talking about whether or not they should get the vaccine.
And our answer, and we strongly encourage people to get vaccinated. This pandemic has influenced our lives significantly, and we finally have an opportunity to combat that, and that's what this vaccine is going to do. The vaccine is safe, like I just said, and the vaccine is most important for people who have underlying health conditions. It's what's going to give us the protection that we need during this pandemic.
All right, and another question I've heard is whether or not people want to know if they have to get the vaccine. Is it mandated?
The vaccine is not mandated. There's no requirement for anyone to have it.
Okay. All right, the next question is talking about what you just mentioned about, is it safe to get the vaccine if I have an underlying medical condition? Because a lot of people, you don't know whether or not they do just by looking at someone. So they're kind of concerned about whether or not they should get it.
And of course, we want everybody to consult with their primary care physician about whether or not they should get it. But generally speaking, the vaccine is safe, and it's even more important for people with underlying health conditions like heart disease, diabetes, obesity, that they have it because they are at an increased risk, and the vaccine is going to give them the protection that they need.
What about, say, blood pressure? I know a lot of people have high blood pressure, but they are on medication and they're managing it. Do those people fall into that category? Because that's always confused me.
They still have that diagnosis of having high blood pressure. So they still fall into the category of being higher risk. So we're encouraging those people to take the vaccine so they have that protection.
What about smokers?
Smokers aren't considered to be a high risk category for underlying medical condition. Okay. But they fall into the general category of the public of it being encouraged to get vaccinated as well.
So along that line, anyone with asthma or COPD, something like that, that is a respiratory type of illness, since this is a respiratory illness, they really do need to get the vaccine, correct?
Absolutely. And unlike smoking, COPD and asthma, those are underlying medical conditions. And we're encouraging those people that fit into that category to get vaccinated.
Okay, good. All right. Why has it come out with 2 doses and not just 1 dose?
Well, the 2 doses are going to give the full protection. So right now, the 2 types of vaccines we have are Moderna and Pfizer, and they're about a month apart for the 2 doses that you get. And in order to get the full coverage, the full protection, both doses are needed.
Okay, so now the time between the doses is different for the manufacturer, correct?
Correct. They're about 28 days and 30 days between the 2.
Okay, so if you get the Pfizer vaccine, can your second dose be the Moderna vaccine and vice versa?
That's actually not the recommendation. The recommendation is whichever manufacturer you start with for your first dose, that you get that same type for your second dose.
Okay, the same manufacturer. And I've heard that there are some other manufacturers coming out with a single dose vaccine, but that is going to be some time before the tests are completed and the safety measures are completed.
Right, so those haven't been confirmed yet.
Right.
So right now, the only vaccines that we have are Moderna and Pfizer.
Okay, and within the health departments here in our district, we are using the Moderna vaccine, correct?
Correct, at this time. And of course, once the Pfizer becomes available to us, we'll make use of that one. But right now, we only have the Moderna.
Okay. All right, we're going to take a quick break and we're going to come back and talk to you some more about the questions that you're having. Attention ladies in the West Central Georgia area who have no insurance or are insured with a high deductible. The Georgia Breast and Cervical Cancer Program provides breast cancer screenings for women ages 40 to 64 and cervical cancer screenings for women ages 21 to 64. Also diagnostic screenings for abnormal results and referrals for mammograms. To see if you qualify, call 706-321-6300 or visit columbushealth.com to find the health department nearest you. Did you know when your blood pressure is high, you're 3 times more likely to die from heart disease and 4 times more likely to die from a stroke? Visit your healthcare provider or local health department and have your blood pressure checked. Or get your own blood pressure monitor and make control your goal.
Food these days can be a challenge. If your child is under the age of 5, on Medicaid or food stamps, you're eligible for WIC. The Women, Infant, and Children's Program provides nutrition education and vouchers for healthy food. So call today and eat healthy tomorrow. Welcome back, everyone. We're continuing our conversation about the COVID-19 vaccine. So our next question, Dr. Hiltz, is, are there any long-term side effects from the vaccine?
And in terms of long-term side effects, there's going to be a need to watch and see what happens with this vaccine. So there's time needed to answer that question. But right now, we know that over 8 weeks of extensive study went into the development of the vaccine and critical clinical trials. So we don't know long-term effects right now. We just know that the vaccine is safe based on the research and study that went into it initially.
And those companies are still continuing to monitor the vaccine and the reactions, if any, that people might have, correct?
Absolutely.
Okay. All right. Another question that people have is, if I have any problems or reactions to the vaccine, what do I do?
So there's a program that the Center for Disease Control and Prevention has developed. It's called VSafe. And that program allows you to be able to submit to the VSafe program if you're having any reactions or side effects. Of course, if we already know that there's going to be some mild side effects like a sore arm and some fatigue, but if there's any long-term side effects, then we ask people to consult with their physician first and to report it on that VSafe system.
Okay, now, well, from what I understand, the VSafe is something that you use with the smartphone?
You can use it with the smartphone. You can also use it with your computer. It's not an app. It's a website that you're using to report any side effects.
Okay. All right. That's good to know. All right. Another question that we have is, if I already have COVID-19, do I need to get the vaccine? Because we know there's many people who have already had the virus. So that's a question that we get quite often.
Okay, and the recommendation that if someone has already had COVID-19, that they still get vaccinated. We do know that when somebody gets COVID-19, it's going to allow them to have some protection, but we don't know how long that protection lasts. So we're still encouraging people, even if you've had COVID-19 before, to still get the vaccine.
Okay, so is there any kind of wait time between, say if you had COVID-19 and you recovered from it and you're feeling better and it's been maybe a month or 2 months or maybe even 6 months, is there a time that they have to wait from when they have recovered to when they get the vaccine?
Well, I'm glad you asked that question, because initially the information that we were sharing was that a person should wait 90 days after they've had a COVID-19 diagnosis, but that's no longer the recommendation. Okay. It's been shown that it's safe. Once a person recovers from COVID-19, they've completed their isolation, they have resolved their symptoms, that they can go ahead and get vaccinated at that time.
Okay, that's great. Good news. The other question that we've gotten is, how much does it cost, and do I need to have insurance to get the vaccine?
The vaccine is being made available to be free to everyone, and you do not have to have insurance to get it.
Okay, that is the best news, I think, for everybody. Now, we've also have lots of questions about people want to know, when is it my turn to get the vaccine? What are the phases, and when is it going to be available to me? So when we come back, we are going to go through each phase of the vaccine rollout and define each phase so you know exactly when it's time for you to get your vaccine. We'll be right back.
Some say e-cigarettes aren't dangerous,
But science shows nicotine can harm teens' developing brains.
no matter how they're exposed.
Let's do an experiment to find out.
Here's a teen who won't be using e-cigarettes.
Now we need one willing to risk their brain development.
Anyone care to volunteer your kid?
Anyone?
I'm Dr. Vivek Murthy, U.S. Surgeon General. Your kids are not an experiment. Protect them from e-cigarettes.
WIC is the Women, Infant, and Children's program that provides nutrition education, vouchers for healthy food, and even health screenings for your child. Qualifying for WIC for your children under 5 is based on your income and family size. To see if you're eligible, call today.
Welcome back, everyone. This is the part of our show where we're going to discuss and show you about the phases of the vaccine that are happening in our state. And Dr. Sante Hiltz is with us to give us that information and help explain those phases to us. Now, we have some slides that we have for you that we can look at. Showing right now is phase 1. So explain who is involved in phase 1.
Sure. So these phases are very important because we currently have a very limited number of vaccine, and across the state of Georgia, these phases are going to allow us to ensure that the most critical of our population receives the vaccine first. So in phase 1A are all of our healthcare personnel and our long-term facility residents and staff, and that includes our EMS staff, our paramedics, and now it also includes our adults who are 65 years of age and older, as well as their caregivers. It includes our law enforcement, our firefighters, and our first responders.
All right, so, and also we want to mention that anybody who is at risk for exposure in a laboratory setting or perhaps medical waste and medical environmental services, those people as well who have a high risk of infection from the virus are also included in that phase.
Correct. Because of their risk of being exposed, that puts them in this first phase 1 category.
And we have questions too about the long-term care facilities. How is it that those residents and the staff members are being vaccinated?
They have established a contract with CVS and Walgreens and some other pharmacies to ensure that they get direct delivery of the vaccine to their long-term care facilities.
Okay. And so when we say that people over 65 years of age, whether or not they have any underlying medical conditions, correct?
That's correct.
Okay.
It's solely based on them being 65 years of age and older.
And we want to remind people too that these are the phases for today in the beginning of January. So it may very well change before, we get through the vaccine phases. So we want to encourage people to go to our website, westcentralhealthdistrict.com, or you can reach it by columbushealth.com to get updates on the vaccine phases and when it's time for you to get your vaccine. Okay, now we move into phase 1B, correct? Phase 1B, who is involved in that?
So in our phase 1B are our law enforcement and our fire personnel, and that includes those who are working in those types of agencies. Our frontline critical workforce employees, like our educational faculty and staff, our court employees, food processing staff, our grocery workers, our transportation and public transit staff, our healthcare distribution employees, coroners, correction employees, and USPS employees as well.
Okay, so also we need to include like United Parcel Service and FedEx as well, I'm assuming.
Correct.
And,
our mail carriers.
And also health care distribution employees. That would be medical equipment and things like that are going to, say, nursing homes or hospitals?
That's correct.
Okay, so that's a pretty good broad list of people in phase 1B.
Yes.
Okay, but at this point, we still don't know when we're going to get to phase B, correct?
Right, and the question comes often of when are we going to move into the next phase? And we do not have the answer to that question because we don't know how long it's going to take us to make sure everyone in phase 1A is fully covered.
Right. So how are we going to really know that when we see registrations dwindle for that first phase?
Well, we're doing it at a state level. So at a state level, our commissioner, Dr. Kathleen Toomey, is giving us instruction about when we're going to move into that next phase. So overall, that decision is going to be made.
I see. Okay. All right, now we're ready to go to phase 1C. And who is in phase 1C?
So 1C are our adults below the age of 64 with a high-risk medical condition and our other essential workers.
Okay. Now, that's everybody under 64, from 64 and under to 20 years old?
Yes, because you have to be 18 or over to receive the vaccine.
Okay.
So, but in that category, you have to have a high-risk medical condition.
Okay. So just those under the age of 65 with a high-risk condition.
Correct.
Which we mentioned before were things like heart disease, diabetes.
Correct.
Okay. All right. So then we move into phase 2. Who is in phase 2?
So our phase 2 is comprised of our adults between the ages of 40 and 64. It's our individuals who live in congregate settings, like our homeless shelters, our group homes, our dormitories. And it's also the individuals in other congregate settings like jails, prisons, or detention centers, and any others living in those settings where many people are going to be in one space.
Now that kind of creates a logistical issue, does it not? Or how people say in a group home setting are going to be getting the vaccine. Is there a way that they would all come to the health department to get the vaccine at the same time, or does someone go to the group homes or the jails? How does that work out, or has it been worked out at this point since we're not there yet?
Well, even though COVID-19 vaccine is a new vaccine, we have had experience giving other vaccines, for example, the flu vaccine in these congregate settings. And we're not going to have those people living in those settings come to the health department. We will coordinate with our outreach team as to how to get that vaccine to the setting.
Okay, good idea. Okay, now we're going to move on to phase 3. And who is in phase 3?
So phase 3 is comprised of our workers in industries important to a functioning society and at moderate risk of exposure. And we have had several executive orders that list those. The list is too long for me to say all of them right now. But some examples are restaurant workers, our hairstylists, our barbers, barbershops. And in addition to those, we also have in this phase 3 our young adults who are age 16 to 39.
Okay. Now, I have heard 16, I've heard 18. So is it 16 from one manufacturer and 18 from the other?
That's correct.
Is that what it is?
Moderna, which is what we have right now, it's 18 and older.
Okay.
But the Pfizer vaccine is 16 and older.
Okay, that's good to know as well. Then we move into phase 4, the last phase.
So in phase 4, this is going to be everybody residing in Georgia for whom the vaccine is recommended, who is not included in any of the other phases. So this is our catch-all. Anybody who wasn't able to get the vaccine before in the previous phases can get it in phase 4. And then once the vaccine is approved for pediatric use, it will also include children.
Okay, great. But at this point, we don't know when that's going to be, correct?
Correct. And at this point, we don't know when we'll progress to phase 4.
Right, and children are in the lowest risk group.
At this time, that's correct.
At this time, okay. All right, well, we have talked a lot about the vaccine and questions that people have, but one thing that people continue to ask us is, do I need to register to get the vaccine? So when we return, we are going to walk through the registration process so that you can see exactly what you need to do and where to register online. So stay with us.
Attention ladies in the West Central Georgia area who have no insurance or are insured with a high deductible. The Georgia Breast and Cervical Cancer Program provides breast cancer screenings for women ages 40 to 64 and cervical cancer screenings for women ages 21 to 64. Also diagnostic screenings for abnormal results and referrals for mammograms. To see if you qualify, call 706-321-6300 or visit columbushealth.com to find the health department nearest you.
Welcome back, everyone. We are going to discuss now the registration process for getting the COVID-19 vaccine. Dr. Hiltz, we do know that in our district we are required to have people registered to get the vaccine. Explain why that's so important.
This is very important because currently our vaccine supply is extremely limited. We're hoping that this won't last forever. At some point, there will be an abundance of the vaccine, but right now we have an extremely limited quantity of vaccine, which means that we have to utilize an appointment system. And to assist in scheduling those appointments, we've created a pre-registration, and that allows us to have a pool of the community members who want the vaccine to enter in their contact information so that once we have vaccine available, we can call down the list of those who pre-registered and schedule those appointments.
It's also very important to register because of the storage requirements for the vaccine, correct? Can you explain a little bit about the temperatures involved and the thawing process and how that all works?
Sure. The number one thing that I want to emphasize is that we don't want to waste any vaccine. And the vaccine is, it has some handling requirements that once it's thawed out and is prepared to be used, if it's not used within a certain amount of time, it will have to be wasted. So we're very careful about ensuring we have people who are committed to coming in for a specific appointment, so we know exactly how much vaccine we need to prepare and ensure that none is wasted. We need about a 2.5-hour lead time to make sure that the vaccine is thawed properly and ready to be used. So we're asking people to be patient with us because there's a lot more people in demand for the vaccine than the number of vaccines we actually have. So we're asking that people pre-register, so that allows us to contact everyone in advance, identify the location, for example, for a mass vaccine, a drive-through style, and then that way we know how many people are coming and that no vaccine will be wasted.
So not only do people need to register, they also need to confirm once they are notified of that time and date to get the vaccine, to make sure that we don't waste it, like you said.
Right,
correct?
and I'm glad you brought that up because what we want people to understand is that there's going to be multiple methods of us contacting you once you've pre-registered and you're in our database. We may send you a message via text, we may email you, or we may call you directly. It just depends on the situation at that time. So pre-registration allows us to have access to you and communicate with you effectively when we have vaccine. And then once that happens, we can say, for example, we have 20 appointment slots. Please select an appointment slot, and we may send a link for you to select that appointment. One of the things that we know is difficult is that there's a lot of people who may not have access to a computer to register or have those electronics. So we do have a COVID-19 call center. You can call our Columbus Health Department and have access to that COVID call center. And we have people on the phone who will do the registration for you. So we're trying to make accommodations for people who do not have a smartphone or who don't have a computer.
Right. Okay, we're going to get into the actual registration process, and we've got some screenshots of our website that we're going to go to so that you can see exactly how to register. The first screenshot shows you the COVID-19 information page at columbushealth.com. There's a red banner at the top of the page that you click on, and it will bring you to this page. So it gives a breakdown of the phase and who is eligible to have the vaccine, and then below it is the vaccination registration form that you will click on, and then it will take you to the next page. And Dr. Asante, could you talk about that for a little bit?
Sure. When you click on the registration link, it's going to ask you just some brief questions: your name, your phone number, your email address, and what category you are in. Even though we're currently in phase 1A and you see the link to register for phase 1A, everybody is able to register for any of the phases right now, even though we're not in that phase, so that by the time we get to that phase, we'll be able to contact you for appointments. So we're asking that everybody, no matter what phase you are in, to go ahead and pre-register.
And it does, again, tell you that you will be contacted by email, text, or phone when it is time for you to get the vaccine to confirm your appointment. So then if you hit the go, you will see the next field where it talks about entering your name, the county that you live in, the city you live in, your email address, and your phone number. And that's very important so that we can contact you when it is time to get your vaccine. Then the next field is whether they're asking the question whether or not your phone is a landline or a mobile phone, and that's important.
That's
isn't it?
important because we are going to utilize text messaging, but if a person only has a landline, then we'll utilize our staff to call. The reason why we do text messaging and emails mostly is because right now there's about 20,000 people in our community who have pre-registered, and as you can imagine, it will be very difficult to call everybody. So if they have a mobile number, we can send a mass text message or an email, and that will help us tremendously get the message out faster. But if a person doesn't have that and they only have a landline, when they check this landline, we will then follow up with them via phone.
Okay. All right, the next field you come to is your date of birth, and that's important because we have to determine whether or not you're in the correct phase. So you would enter that there. And then it's going to ask you more specifically what group in the phase you are in. And it has several categories. And for this particular person that we've entered, they're in the 65 and older category. So that's what we have checked there. But you check whatever, and there is a space for other in case there is some other category that you fall into that is not listed above. And Dr. Hiltz, if you could explain this slide, it's talking about it lists all the counties in our district. What is that for?
Okay, so we have 16 counties in our West Central Health District, and we're asking people to select the county that they prefer to receive the vaccine from. And that's because if we have any specific vaccination opportunities in one particular county and you've selected your county of preference, we will send you that communication for that county. We want to make sure people understand that just because you select a county of preference, you'll still be informed of all of the other opportunities in different counties. We also want people to understand that you do not have to be a resident of that particular county to get the vaccine from that county.
That was going to be my next question.
Yes, because we have a lot of people who say, well, I would prefer to come to Columbus, but if Columbus doesn't have any appointment slots and there's an appointment slot open in Chris County, can I go to Chris if I don't live there? And yes, the West Central Health District is a district collectively, and as long as a person resides in Georgia, they can go to any of our counties to receive the vaccine.
And that's also good too, is like for people who live in one county but work in another county, they may want to get their vaccine before they go to their job in another county. So that's very helpful. It makes it a lot more convenient.
Correct.
Okay, so then our last slide tells you when you complete the registration process, it gives you your message there that you've completed it and that you'll be contacted. So it's really hardly takes any time at all, and it's very important to be registered for the vaccine. So we want to make sure that everybody has the opportunity to go to our website, columbushealth.com, and register for the vaccine, and that will allow us to have your information and contact you when we are able to give you that vaccine.
And it's important to remember as well that once you select done, once the survey is completed, you're not going to receive a call from us immediately or a text immediately. Mm-hmm. There's not going to be any additional confirmation. Once that information is submitted via this form that you're completing, you'll have to wait for us to contact you, and that might be a week or 2 weeks, depending on how much vaccine we have. So we just want people to have some patience as we're trying to get the communication out to everyone, right, because of the high volume of people who want it and the demand. And just understand that once you submit that pre-registration, it's been received, and it may take a while for you to get some communication from us.
That is really important because I know I'm a person that's very impatient, and when I do something like that, I want it right away. But it's so important to wait because of all the other factors that enter into this massive community effort of getting people vaccinated, and just the people in Columbus that, we have 100,000 people and more that want to get the vaccine, but we can't do it all at once. And based on all those factors that we talked about, it's going to be something that really requires patience.
That's right.
But know that anybody who does want to get vaccinated will be able to be vaccinated.
Yes, eventually.
All right. Thank you so much, Dr. Hiltz, for joining us today and answering all our questions. If you have any other questions that we didn't cover today, please call our call center at 706-653-6613. And you would choose option 1. You can also go to our website, columbushealth.com, and click on the COVID-19 information page. We have information about the vaccine. We have information about testing, because as you know, right now we're seeing quite a few cases of COVID-19. So if you need to get a COVID-19 test, you can go to our website and register for the test also. So thank you all for joining us today, and you have a good day and stay safe.